Mrs. Williams and Charlie. We are your nurses, and we will be explaining hypertension and how it relates to your condition. To start off, I will explain what hypertension is. Hypertension refers to an elevation in a person's blood pressure. Blood pressure readings consist of two numbers, your systolic and diastolic blood pressure. Think of a heartbeat. There is a pulse, then there is a moment of rest. In the moment that your heart beats, when you feel the pulse, it creates pressure in the blood vessels that run throughout your body. We measure this pressure as your systolic blood pressure. In the moment that your heart is at rest, when you don't feel a pulse, there is still pressure in your blood vessels, but not as much. We measure this pressure as your diastolic blood pressure. These two numbers put together create your blood pressure measurement, the first number being your systolic blood pressure and the second number being your diastolic blood pressure. When a person's systolic blood pressure is above 130 millimeters of mercury, or their diastolic blood pressure is above 80 millimeters of mercury, this is considered high blood pressure or hypertension.
One of the major consequences of hypertension is a stroke, mainly ischemic strokes. Hypertension increases the amount of pressure of blood flowing through the blood vessels. High blood pressure puts a strain on the heart by making the heart work harder to pump blood for circulation and causes the blood vessels in the brain to weaken. This strain can damage the blood vessels, causing them to become harder and narrower, which is a condition known as atherosclerosis. This can also damage the cells in the inner lining of the arteries. So, when the blood vessels narrow and harden and fats enter the bloodstream, the fats can build up in the damaged blood vessels. There will be a limited blood flow throughout the body and potentially a formation of blood clots, which is what causes a stroke to occur. To sum everything up, hypertension contributes to the ischemic strokes because the high blood pressure narrows and weakens blood vessels, allowing blood clots to form, which prevents blood flowing throughout the body, especially to the brain.
The medication prescribed for you to treat your hypertension is called metoprolol, also known as beta-lock or Lopressor. You'll be given a tablet to take by mouth 2 times a day. By taking this drug, your blood pressure and heart rate should decrease. It should also lower your risk of getting a heart attack. As your blood pressure lowers, you should have an increased amount of blood and oxygen to your heart. The way this drug works is by blocking the activation of beta-1 receptors, which increase your heart rate. This relaxes your blood vessels and slows your heart rate to improve blood flow. It is important to take this medication at the same time each day. If you accidentally miss a dose, you should take it as soon as possible, as long as it is at least 8 hours before your next dose. But in any case, do not double on any dose.
You should understand your response to this drug before taking part in activities such as driving, as it could cause drowsiness. It is important to realize that this medication helps to control hypertension, but doesn't cure it. This medication works best when combined with certain lifestyle changes. These include managing your weight, limiting how much sodium and alcohol you consume, reducing your stress, exercising regularly, and refraining from smoking. Most importantly, even if you feel you are getting better, do not suddenly stop taking this medication.
When going to follow-up appointments with Dr. Walker, it is very important that you notify him of any side effects you experience while taking your new medication. It is crucial to report these side effects because they may indicate harmful consequences of the drug, and Dr. Walker can help you monitor the intensity of your side effects by possibly prescribing you additional medication. Common side effects of metoprolol include fatigue, weakness, anxiety, and drowsiness. Due to these effects, Charlie must be extra cautious in assisting you during your daily activities. Life-threatening adverse effects of metoprolol include bradycardia, which is a slower than expected heart rate, heart failure, and pulmonary edema, which is a buildup of fluid in the lungs. These adverse effects are rare but very severe, so any indications, such as excessive weight gain or abnormal breathing, must be reported immediately. Additionally, when reporting back to Dr. Walker, please let him know if your conditions are improving or worsening so he can adjust the doses of your medications. Since you are taking multiple medications, it is important to regularly monitor your blood pressure and blood sugar to ensure the medications are effective. It is possible that your hypertension medication can alter the effectiveness of your insulin, so please report to Dr. Walker if any changes occur.